You're listening to Navigating Eldercare, where you'll find guidance and answers for every step of the eldercare journey. Each week, eldercare advocate Laura Daniels brings you expert insights and practical solutions to help families and professionals make confident care decisions.
Hello, my name is Laura Daniels, founder of Care Advocates and your host for Navigating Elder Care. For years, I have been helping families and medical providers, doctors, case managers, social workers, nurses find the right solution for seniors in transition. Whether that is after a hospital stay, a rehabilitation stay, or when care needs at home have changed, we assist in finding the right care options. I started this work because I saw how overwhelming and confusing the elder process can be, and I wanted to be a guide and a resource for both families and professionals. Each week on Navigating Elder Care, we tackle the real questions and challenges that families and providers face during care transitions. I've spent the last 30 years working as a registered nurse specializing in geriatrics, and I have dedicated my career to advocacy and care transition planning. This podcast brings together my experience and my passion to support you on your journey. In my business, in my work at Care Advocates, we walk alongside families every step of the way. We meet with families, clients, and providers to create a customized care plan. When someone is needing assistance, such as assistance with bathing, dressing, toileting, mobility, we provide options such as residential care homes, assisted living communities, memory care communities. We advocate, guide, and educate throughout the entire process. Most importantly, we provide ongoing solutions and support. The care journey should never feel overwhelming. It should feel supported, guided, and understood. Welcome back to Navigating Elder Care. I am your host, Laura Daniels, and in today's episode, I'm very excited to have Mona Talukdar with us. Mona is a highly respected leader in the senior care space. With more than 12 years of hands-on experience in memory care, she has been recognized multiple times for excellence in dementia and memory care services. She serves on the board of the Alzheimer's Association and was recently chosen by Medicare as one of only 390 participants nationwide in the new guide model. Our community is so proud to have Mona leading this important work. She is a dear friend and a mentor to myself and to so many others. Mona, thank you for being here today.
Thank you, Laura, for having me. I'm really glad to be here.
So, Mona, we're going to talk a little bit about the guide. Can you start by explaining what exactly is the Medicare Guide program?
So the guide program stands for Guiding an Improved Dementia Experience. It's a brand new program. It's designed specifically for people living with dementia and the caregivers. For the very first time, Medicare is funding not just medical care, but also navigation, education, respite, and support the families that desperately need on this journey.
Mona, why was this program created, and why is it considered groundbreaking in the dementia care space?
It was created because dementia is different from other illness. Families aren't just dealing with medical symptoms, but they're also dealing with caregiver burnout, behavior changes, and constant uncertainty. And it's groundbreaking because Medicare has never invested in the skill to support a caregiver and respite services. It's a recognition that dementia is now a family disease and the system must care for both caregivers and patients.
Very well put. It's a family disease, and we see that a lot. We see that this is not only affecting that person with the diagnosis, but it spills in over into the caregiver, into the wife, the spouse, the children, everyone. Mona, what makes Guide different from other Medicare benefits that we have seen in the past?
See, unlike other Medicare benefits, which they have many, Guide is bringing everything under one umbrella, like dementia-trained navigators, structured caregiver education, 24/7 support system, counseling, even paid respite care services. It's very proactive, not reactive. Instead of families waiting for crisis to qualify for hospice or hospitalizations, Guide walks along them with them, and it makes it much easier for the families to be already involved in a system or a benefit that's going to only support them further.
Very interesting. Let's focus now on the eligibility and enrollment for the Guide. Who is eligible to participate in the Guide program?
The most important thing is anyone that has a formal diagnosis of dementia and has traditional Medicare. When I mean Medicare traditional, they need to have Part A and Part B, and that is what's going to qualify them. And as long as they're living in their house or in a senior living community, they will qualify, but they cannot be living in a nursing home, or they cannot be on hospice services to be eligible.
Okay, so to clarify, does it apply to Medicare Advantage members or just traditional Medicare?
Just traditional Medicare.
Only traditional Medicare. Okay. And you touched a little bit on this, but I'm going to ask you again. Can someone living in assisted living participate? And what about those who live in a long-term care setting, who live in a memory care community, who live in a residential care home, and those on hospice? Can you tell us if they qualify?
So as long as the patient is living in an assisted living, when you mean assisted living, either it could be a independent living, an assisted living, or memory care, they will be covered. But if they are living at home, it will be covered. What is not covered is when they live in a nursing home, or if they're on hospice services or PACE services. Those are the exclusions. So that means a patient with dementia diagnosis having traditional Medicare, living at home or any senior living community that's private pay, they are covered.
How does a caregiver or a family member find out if their loved one qualifies for this?
The simplest way is to call the guide organizations, and Medicare has this published on the CMS website. And they need to look for local guide participants, and they are available online, and you can take their name, numbers, and call us back. Like for us, visiting practitioners in palliative care is a guide participant. They can call our office and they can qualify.
Okay, so for all of our listeners, right, as you hear about the guide program and all of the advantages and benefits, know that Mona is here locally in San Antonio. And if you want those services for your loved one, that number is 210-960-2833. We will repeat the phone number at the end of this podcast radio show, but you will also be able to access that on my website. We'll have a link to Mona's, to this guide program. Tell us about the program benefits. What does Guide offer to families and caregivers and patients?
So the Guide provides dementia-trained care navigators. It gives you 24/7 phone support. It gives you individualized care plans, a structured caregiver training program, support groups, counseling, respite benefits, and regular assessment to track needs as a disease progresses. As a disease is going to change, you have trained navigators to help you at every step of the way. It also includes home assessments.
What does the phone support look like? What does that mean?
So anytime, 24/7, you can pick up your phone and dial the number of our office, and there will be a care navigator behind the scenes for you to access them. A live person, not an online person, but just a live person that already knows about your husband or your wife or your loved one, and then we can help you navigate the system in case you had a fall at home, or there's a change in behavior, or there's a change in status, and you need somebody to just guide you through to what the next steps are. You have your own personal navigator accessible to you 24/7.
Okay, it's like having an assistant
Absolutely.
to manage your loved one's care or
yes,
your husband's
it's like your own
care.
personal secretary. Basically, they are the ones that has all the information of your loved one, and they can help you through the entire system, whatever is happening at that moment.
So when they're calling, they're looking at a screen,
Yes.
all of the history comes up, everything that patient has gone through,
Yes.
and
the behaviors
research.
or change in status or what happened, what medications they're on. And in case they need to go to the hospital, they can help you with that. In case they don't want to go to the hospital and they just had a fall and they just in pain, we can send a mobile x-ray there. Or they're having a change of status. Maybe it could be a UTI. We can send a lab to collect the urine and make sure rule out many things as possible instead of going to the ER. It's very difficult to take a dementia patient to the ER and sit for hours in the ER. And it's impossible to manage behaviors in ERs. Currently, I don't think there are systems in place that can manage behaviors in the ER. So it's better to have these things done at home, and that's what we can help with behind the scenes.
So I've been hearing about the guide for a very long time, and just so honored that you're here, that you're one of the participants. And so what I've been hearing a lot when I've been learning about the guide motto is the word care navigator, and you've mentioned it a little bit. Can you explain the role of the care navigator, and why is that such a big deal? Why am I hearing so much about that? What does the care navigator do within the program?
The care navigator is an important link for your health needs. Basically, there's a care navigator, a well-trained care navigator that's proficient in dementia. They have to go through the entire training and education to be called a care navigator. That care navigator knows your loved one inside out. What are their needs? What is their level of functioning they're having? Can they take meds? Can they talk? Can they walk? All those details they know. So it's like your own personal secretary behind the scenes. Now, if there is any change, that care navigator can coordinate care. They can send you to the hospital. They can send you to a specialist. They can arrange your counseling. They can arranges respite services in case you as a caregiver are extremely tired and you just want a break. We can arrange respite services. The respite services could be means we can send somebody at home. You can go to an adult day care program. Or if you want to go somewhere and spend overnight somewhere just to get a little break, we can do a respite overnight stay. And this is all paid by Medicare.
There is no cost to the families.
No,
correct?
It's a zero
Okay.
cost. It's a benefit for Medicare patients. So there is zero cost to the family.
Mona, you mentioned earlier a home assessment. What does that look like in practice?
So once you are aligned, or once Medicare accepts you as a patient with dementia, then we can, within 2 months of alignment, we send either a nurse or a therapist to your home. That person will go and assess your home for safety. Is there a ramp? Is there steps? Do you have a bathroom upstairs or downstairs? Do you need hand railings? What can we do to make sure your loved one can stay at home safely and avoid falls? That is the most important aspect of a home assessment.
Okay. You mentioned the word alignment. Does that mean the onboarding process?
Yes.
Okay.
So when I mean alignment is if you have a diagnosis and you have Medicare, now you want to be part of Guide system. What we have to do is complete a comprehensive assessment, collect all your medications list, contact your primary care physician, contact your neurologist if you're seeing one, collect all the medical records. If you have seen or not seen a geriatric, that's a dementia specialist, we gather all your medical records. We complete an assessment, upload it into Medicare system. Once Medicare looks at it and they see that your diagnosis has already been established, then Medicare says, okay, this patient can get Guide services. And that's called an alignment.
One of the most important, exciting aspects of this Guide program is the education and training for the caregivers. Tell us why that is so important. And in the space that you're in memory care and dementia, why is this piece so important for caregivers, Mona?
It is very important. As caregivers, taking care of a dementia patient 24/7 is very, very difficult. The toll that happens to a caregiver is very silent. And many, many studies have proven and shown that a caregiver stress or the caregiver burden is very costly to the caregiver. So they have recognized that burden. And that's why having these kind of education, how to understand dementia behaviors, how to communicate with the dementia patient, stress management, self-care, it becomes a very critical because dementia doesn't come with a playbook. Without training, caregivers often burn out, and that leads to hospitalizations or placements. So it's very important to train the caregiver to understand what's happening at that stage of dementia. And it changes in an instant. The changes in dementia patients in their behaviors is instant. And one day you're sitting there and having a nice meal. Next morning, your loved one doesn't recognize you. They find you a stranger in the room. They're hallucinating. The change is so fast. Without having that education, without having the tool set, it becomes emotionally draining and it physically drains the caregiver.
Speaking of the caregiver burnout, on last week's episode, when we talked a little bit about how to create a caregiving plan for your loved one, it's pretty much a framework of how you want your care to look like for yourself or for your loved one. We talked about Ohio State University and National Institute on Aging study in collaboration. They collaborated, and a study found that caregivers of dementia patients exhibited biological changes indicative of accelerated aging, meaning that their lifespan, Mona, is shortened by 4 to 8 years and compared to non-caregivers. And
it is absolutely true. We see that all the time. Whenever we have a caregiver coming to our memory care, we see that often that the caregivers are extremely tired, not having sleep, not sure what's going on, and it makes it very, very hard for them to deal with their loved ones' dementia thing. I also wanted to add more details on respite.
Okay.
Respite is a short-term relief for caregivers. Under Guide, Medicare will actually pay for professional help to step in, whether that's an actual adult day program, a private duty in-home support, or a week of overnight respite. It gives caregivers time to rest, recover, and sustain an ability to keep caring for the long term for their loved one. This respite service is the most important part of Guide, I feel, because here we're giving the caregiver a little break, even getting an in-home care support person once a week, just so they can either rest, sleep, or go get their nails done, or get some shopping done, get some groceries. It's a huge relief to caregivers.
Thank you for speaking about respite. It is important. Mona, let's shift now to access and availability. I mentioned there are 390 Guide programs across the country. How do families find one near them? For those that are listening to our podcast, Right. Those that listen to the radio, you're in San Antonio, so we know to call Mona. But how do families that live in a different state access the GUIDE program?
The families can go to Medicare website and put in GUIDE program. And the GUIDE program there has an entire Excel list of all the GUIDE participants in their area. Or they can call 100 Medicare to find out what the participation organizations are in the area. Many hospital, hospice, medical groups are part of it. Also, if you find a local one, that's fast. If you don't have any local participant, then you will have to work with someone that's online. But having a local participant that's in the area, that understands the area, understands you, and has a local presence that's going to actually make home visits is amazing.
What kind of support groups or classes are offered, and how do caregivers know which one fits best for their needs?
So every GUIDE participant is required by Medicare to create these support groups or classes. There are going to be different ways of doing it. We have dementia-specific caregiver groups, stress reduction classes, caregiver groups, advanced care planning sessions, social activities. And what we are doing is creating these caregiver support groups based on the needs that our caregivers are asking for. Navigators or the care coordinators help families match to what their requirement is. There are also many online classes that you can take, videos, which we'll be posting to our caregivers so they can see it. Like for an example, if you have a loved one at home, they have a UTI. How do you manage UTI? What do you need to do? How do you recognize the symptoms of a UTI? What happens with dementia and UTI? That is something to understand. Sometimes they do not represent a typical symptoms of a urinary tract infection. When I mean UTI, it's urinary tract infection. Right. But in dementia patients, UTI is deadly. The change of behaviors is instant. They get aggressive. They stop eating. They have a fall. But they will not show fever. They may not have other symptoms like you and me would get if we had a urinary tract infection. In a dementia patient, UTIs or urinary tract infections need to be carefully monitored and responded fast.
And that's part of the education and training that you get with it.
Very important, yes.
So let's focus a little bit now on integration and existing care. Mona, how does GUIDE integrate with the patient's existing medical team?
So GUIDE doesn't replace your doctors. That means you keep your doctors, you keep your primary care physicians, you keep your neurologist. We don't take over your clinical care. We are GUIDE. That means our role as GUIDE is we just come in between. We become part of your team. We become a part of your system, and we help you navigate the disease program. Basically, we will help you navigate the system. It is very hard. For example, if your husband had a fall and you had to go to the hospital, you have hospitals saying one thing, oh, he needs to go to rehab, he needs to go to nursing home, he needs to have home health. But as a dementia patient, what is actually good for your loved one? What is going to benefit the most? That is where we step in and help you. Okay. That is what we do at home, and we are your personal navigators, and we are specialists in doing this.
So if they've had their existing doctor for 20 years, their same primary care doctor, they can still keep that doctor?
Yes, ma'am. You don't need to change anything.
So a little more to expand on this. What kind of coordination happens with, for example, not just primary care doctors, but specialists and other providers? Can you talk a little bit about the coordination?
So the GUIDE team, your team, the back team is going to share all the care plans, updates, behavioral strategies, changes directly to your primary care provider. We are required to be sending an email or a fax notes exactly what's going on. So your primary care physician gets detailed notes from our GUIDE care coordinator, so they have all the details to follow up. So our goal is to submit it every week whenever we call you to check up, to give them information.
Okay. So let's talk a little bit about the caregiver. Mona, what responsibilities do caregivers have as part of the GUIDE program? What is their responsibility?
Because the importance in the GUIDE is given to a caregiver education, the expectations is back is that caregivers need to engage actively, participate in assessment, attend trainings, communicate honestly about what their own needs, and use a respite benefit. The program only works if the caregivers are partners. But if the caregiver doesn't participate and doesn't tell us what's going on, it's very hard to help you, right? Mm-hmm. Our goal is to help the caregiver. Our goal is to be their support system. And we need to be part of their own inner system. And that is what the caregivers need to do with us. We honestly share what is going on so we can help them.
And that's what the GUIDE is, right? They're recognizing that the caregiver needs as much support and attention as the actual patient with the diagnosis.
Actually, more than the patient, it's the caregiver. It's the burden they're carrying is what we need to address.
Mona, let's look at big picture, long-term impact. Since GUIDE is an 8-year pilot, what outcomes is Medicare looking to measure?
I think Medicare is looking at caregiver stress relief. How many hospitalizations does the patient have? What are the number of visits that are happening? Nursing home placements and overall cost. The entire goal for Medicare at this time, as of changing America's demographics, as America is aging, more patients with Alzheimer's and dementia is being diagnosed. And every day we see more and more patients diagnosed. The hope is that the guide will show improved quality of life and reduce healthcare spending. In the end, it's all about cost and reducing it. But also the importance given to the caregiver burden and quality of life is very important a role Medicare has stepped up this time to take over and help the caregiver manage their loved one at home.
And Mona, you and I, we work with families all the time, and we know that they're not always very forthcoming about all of the dementia, whether that's behaviors or symptoms that their loved one is exhibiting. So my next question to you is, why is it important for caregivers to be honest in their assessment and feedback when the onboarding begins?
The program only adapts if families share the truth, whether they're burnt out, struggling with behaviors, or not sleeping. Very important for them to have honest feedback back to the Navigator, connect the right resources, and it helps Medicare understand the real challenges. Our society doesn't really allow, as a caregiver, to show weaknesses, show the burnout. We always want to work, take care of them, because in the end, our idea is not for our loved one to go somewhere else. But dementia is not your regular disease. Because the mind changes, the behaviors change, it creates a greater impact on the family members, especially Alzheimer's and dementia, because they forget. The short-term memory loss is so acute, and the behaviors, it's not the same person they have known for over 25, 50 years, 60 years, and that makes it harder. So it's very important for the caregiver to share their burden with us.
Mona, can you think of a case study? You can give us a case study of perhaps a family, a caregiver, a patient who would benefit from this guide program? For
example, because I do this every day, we had a family that wanted to come in. They're still living at home. The patient has dementia and Parkinson's, and they're not ready yet. They're not ready to do placements. But she was very interested in the guide program. Even the little support system we're going to offer her, that's going to allow her to keep her husband at home longer. So she was very forthcoming. What she wanted, how she wanted it done. It was very enlightening to see a caregiver come up and say, I need help. Usually we don't hear that I need help. We always hear no, we're fine. I'm managing it home. And sometimes it takes a tremendous toll on the caregiver.
Yeah. And again, you mentioned earlier, this guide can go anywhere with a patient and a caregiver, whether they live at home, long-term care, assisted living, memory care, a residential care home. This program can follow your loved one wherever they live.
Yes.
Mona, what do you hope Guide will accomplish for dementia care in the United States and possibly even globally? What are your hopes for Guide?
I think it's going to change the dementia care. It's going to include, always include the caregiver support. If this is successful, it means Medicare policy and model for other countries is treating dementia not just as a medical condition, but as a family journey that requires wraparound care. Instead of walking alone, you have an entire team supporting you every step of the way. Then the journey becomes much easier. Because the mind changes in dementia, we need support. It can be very isolating for the caregiver. And the idea is to help the caregiver cope and continue the journey and have that support system for them to be successful managing the patient at home.
Mona, is there anything I forgot to ask you? Anything else you want to mention or say?
Dementia is very isolating. And the idea of having the families not be alone at anymore. Guide is here to walk alongside them. And I think having that idea that if I pick up my phone, I'll have somebody there on the other side that can help me, I think it's a very important and reassuring factor in this program.
Thank you. Mona, it's been an honor to have you here speaking about such important work, and the work you do it makes an impact in families every single day. And I know everybody who's behind you, your entire team, you're doing amazing work, important work. So thank you for being here with us today.
Thank you so much, Laura, for having me. And they can reach us directly at Visiting Practitioners in Palliative Care in San Antonio. We are one of the guide participants. They can call our office, visit our website, connect through Alzheimer's Association and Medicare listing. We are here to help you.
Thank you for joining me on Navigating Elder Care, where we bring guidance and answers for every step of the elder care journey. If you are a family member, hospital case manager, or healthcare provider, and you know someone facing a change in their health or planning for future care needs, Care Advocates is here to help you find the right care at the right time. Whether it is assisted living, memory care, or bringing trusted resources into your home, we walk alongside you every step of the way. At Care Advocates, this is what we do. We get to know you, your loved one. We meet you personally, whether that's at home or at bedside. We create a customized care plan. We discuss care options that fit your needs, budget, location, care needs. We provide ongoing solutions and support. Our commitment is simple: care, compassion, lifetime support. For a free consultation, call me at 210-669-2222. Be sure to subscribe, like, and share this podcast, and visit us at advocatern.com. That is ADVOCATE-RN.com for helpful resources such as what we spoke about with Mona today, the guide. If you have a question or an idea for a future episode, you can email me at Laura, Laura at advocatern.com. You can also listen to us here every Sunday at 8:30 on 9:30 a.m. The Answer. I am Laura Daniels, and this has been Navigating Elder Care, helping you find the right care at the right time for the people that matter the most. Thank you.
This has been Navigating Elder Care with Laura Daniels, providing guidance and answers for every step of the elder care journey. For a free consultation, call 210-669-2222 or email Laura at advocatern.com. Catch every episode on 9:30 a.m. The Answer, YouTube, your favorite podcast app, or at advocatern.com.